Hey everybody, it's Faheem here and welcome to this video on how to find a designated prescribing practitioner in Manchester. As always, subscribe, like and share, and let's get into this video. So first of all, why am I making this video on how to find a designated prescribing practitioner and who is the video aimed for? Firstly, let's talk about who the video is aimed for. And this is for those healthcare professionals who are looking to gain their prescribing qualification. Now, folks, keep in mind, if you're not a healthcare professional, you may not be eligible to undertake this course. So it's always important to check with the university or do a bit of research to find out what the legalities are around undertaking the course itself. But as a quick tour around, pharmacists, nurses, physios, paramedics, and so on are eligible to undertake the course itself. So this video is for those individuals who can undertake the course. Now let's talk about a designated prescribing practitioner and why this is so important. Irrespective of your profession, the NHS has a shortage of doctors, nurses, and they are looking to other healthcare professionals or the peripheral healthcare professionals to help really support the NHS workforce. And one area that they're focusing on is improving access to healthcare. So if we can help the other healthcare professionals or allied healthcare professionals to gain their prescribing competencies and gain their prescribing qualification within a set scope, so within a certain area, then that can essentially, in theory, help improve access to healthcare. That is why this has all come about. And non-medical prescribing, actually, folks, has been around since the 1990s. So it's quite a long time. It has been around, and there's plenty of evidence to suggest the benefits in terms of improving access to healthcare, improving job satisfaction, patient satisfaction, and so on. But where is the issue? The reality is, to undertake the prescribing qualification, there are three key components. Number one, you have to be an allied healthcare professional who's eligible to undertake the course. Number two, you have to be qualified for a certain number of years. And number three, you need a designated prescribing practitioner, and nurses will call that a prescribing assistant, or rather actually the word they use, a prescribing, sometimes they call it a prescribing supervisor. But actually, I don't know what the heck I'm talking about. What's the word? Practice assessor. Practice assessor. So we got to restart this. Cut. No, let's start. Hey everybody, it's Faheem here and welcome to this video. We are going to be talking about how you can find a designated prescribing practitioner in Manchester. As always, subscribe, like and share, and let's get into this video. So firstly, who is the target audience for this video? Well, for those individuals who are eligible to undertake the prescribing course, for example, pharmacists, nurses, physios, paramedics, and other healthcare professionals, this is for you. If you're a beautician or you're not an allied healthcare professional, this video may not be suitable for you because you will not be able to undertake the prescribing qualification. So that's the audience done. Now, why is this video even relevant? Well, if you look at policy, the NHS has a shortage of doctors and nurses. There's a workforce crisis, but also we want to improve access to healthcare. And to improve access to healthcare, we need the workforce. Doctors, difficult, long journey, and not everybody wants to be a doctor. So the NHS has turned to allied healthcare professionals, for example, pharmacists, nurses, to gain their prescribing qualification, and which has actually been around since the 90s, which shows and evidence suggests that it does improve access to healthcare, job satisfaction, and patient satisfaction and choice. That's why if you are looking to become a prescriber, you're absolutely on the right track. Let's talk about how you become a prescriber. First of all, you need to be qualified for a certain number of years, depending on your profession. You need to have experience in an area, and the key thing is in an area that you have experience in, not in an area that you want to or enjoy developing, in an area that you have experiences or had experience in. You need to find a university that will undertake the course itself and meet the regulatory requirements. For pharmacists, the GPHC accredited courses, for nurses, the NMC. And then what you need is a designated prescribing practitioner. For nurses, you might call that a practice assessor. Pharmacists call it a designated prescribing practitioner, and for short, it's called a DPP. In this video, I'll be using those terms interchangeably, so don't get confused. Now, why are we finding it so difficult to find a DPP? Well, the reason is because there's already a workforce shortage. There's a crisis, we know that. And there aren't that many designated prescribing practitioners who have A, the experience, secondly, that they want to do it. Because unfortunately, folks, there isn't much of a financial incentive. Now, that's a separate conversation, whether there should be a financial incentive or not. But the point is, there isn't much of a financial incentive. That's why there aren't many out there. And the ones that are out there, you need to make sure that one, they have done this before, they have the relevant training, they've been prescribing for 3 years, and they understand the competencies to become a designated prescribing practitioner. So remember, if you are looking for someone, keep these things in mind. Also, if you're a pharmacist, you know that 2025 and 26, when you qualify, you need to gain your prescribing qualification. So now not only are existing pharmacists struggling to find DPPs, but the new pharmacists that are qualifying in the foundation years also need a DPP. So you can see it starts to become challenging. So how do you find one? In Manchester, I would suggest the first thing you should do is contact the local NHS Manchester University Hospital. That's the first thing you should do. Get in touch with them. Start to build relationships. If that hasn't worked, contact your local PCN. Get in touch with the PCN leads. You may also find it beneficial to discuss and get in touch with the ICBs. And again, the whole NHS framework is changing. We're moving away from ICBs and always things are changing, but there's always that higher authority that you can get in touch with. If you've tried this and there's no luck, and I've explained to you why you might find it difficult, it might be an idea for you to speak with your own contacts. So get hold of your phone, start to scroll through, have a look at how many contacts, how many people you actually know. And this is the key thing, folks. It's not what you know, it's who you know. So if you have a wide variety of contacts, it's likely that you're going to be able to find someone and that solves your problem. But let's say you don't have the time. You don't have access to a wide network. And unfortunately, as healthcare professionals, we're so used to working within our closed environment, we don't have access to all these different contacts, so we don't have the time to network. Then I would suggest using social media. If you log on to, for example, LinkedIn, you can start to easily send connection requests, friend requests, and start to build a network. Because remember, the more people you know, the more links you have, the more networks you have, you're going to easily be able to find solutions. That might be from pharmacy business, finding a DPP, and so on. You can easily do that. So that's what I would recommend. What you should do is go onto LinkedIn, go on the search, type in doctor, and that's easy because it's easy to find, because not every pharmacist or nurse will have that they're a prescriber and so on. Why I'm saying doctors? Well, technically, any professional, pharmacist or nurse, dentist, let's leave dentists and doctors for now, pharmacist and nurse who've been qualified for 3 years, have already taught, have experience, can act as a DPP. But I would suggest sticking to doctors or experienced healthcare professionals who've done it before. And on LinkedIn, typing doctors easier than IP pharmacist, IP nurse. That's why I suggested type in doctor, have a look, send a friend request. Just say, hey, my name is XYZ, I'd like to connect with you, and keep it very general, but also keep it very, I would edit it in that, don't keep it generic. I want to connect with you, I find your profile really interesting. No, be natural. Hi, my name is Faheem. I'd like to get to, I'd like to send become a network or network with yourselves. I'm interested in your prescribing course. Is it something you can help with? Thank you. Something like this along the lines so you get to the point itself. And let's say that doesn't work. Then absolutely you can get in touch with us at Medlearn. We not only can organize a supervisor for you, for example, your DPP, but we can help develop your competencies, because it's not just about developing or gaining your prescribing qualification. Really important, because if you look at the learning outcomes for the course itself, or for those of you who are not familiar with educational lingo and so on, what you intend to gain from the course itself, the course is very clear. It's not designed to teach you clinical skills. It's not designed to make you competent in your scope or expand your scope. Rather, it's designed to test and assess that you're competent within a scope that you already have experience in. For example, as a pharmacist, you may say, okay, I'm a community pharmacist. What do I see many of? I see ear, nose, and throats. I see skin infections. I can already diagnose skin infections. I can do ENT. I have the experience. I've done it for years. I've used PGDs in the past. So now what I want to do is to gain my prescribing qualification. That's rationale, sounds right. You can gain your prescribing qualification. But what if you wanted to say, okay, I have an interest in developing my knowledge in diabetes. Let me do my prescribing course in diabetes. That's where you're going to get it wrong. Why? Because you only have 90 hours at university, or rather with your DPP. You've got to do a 6-month course. In that course, there's going to be a portfolio you have to do. There's going to be exams. There's going to be OSCEs. It's really testing your existing competencies. It's not testing, or rather teaching you to develop new competencies. Keep that in mind. And briefly touching on competency, what makes you competent? It's being able to develop the skills, knowledge, and behaviors, or demonstrating this against a set standard. So somebody has to mark or assess you to make sure you meet that standard. So there's a lot in this video. It is absolutely doable. If you need some advice or you're struggling to find one, get in touch with us at Medlearn. Thank you for watching. Hey everybody, it's Faheem here and welcome to this video on how to find a designated prescribing practitioner in Manchester. As always, subscribe, like and share, and let's get into this video.